What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, September 25th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there, and you need to be informed with what's going on with each and every one of these viruses. That's what I do here on my channel each and every day to try and keep you informed on all the latest information on COVID, flu, RSV, norovirus, mpox, measles, whooping cough, and a whole bunch more viruses. Today, we're just doing a shorter version of the pandemic update. Didn't really have time for a full data-filled update, so we're doing one of these out in the wild updates. But I do have some notes for you today. First off, if you're new to my channel, welcome to my channel. Hit that subscribe button down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. All right, we do have several things to talk about in my notes for today. As you can see here, I did have enough time to write a few things down. And first off, in Pennsylvania, well, we have several things in Pennsylvania. Actually, let's go to New York State first. First off, in New York State, 1,079 new cases were reported in the last 24 hours. That's slightly higher than the day before. And the day before, as we know, it was below 1,000. So, yeah, it's not good to see that up, but again, their cases this week are continuing to be down from last week, and hospitalizations, they continue to drop as well. I don't have that number written down here, but it does appear that hospitalizations overall are starting to go back down once again. All right, yesterday, after yesterday's pandemic update was recorded, we found out that Ringo Starr had to cancel a few performances. One of them was to be here in the Philadelphia area at what was called the Mann Music Center. And he's, quote, dealing with a cold. Does that mean he actually has COVID? I don't know. We do know for insurance purposes, a lot of performers are not allowed to disclose whether or not they have COVID, but two of his shows have currently been canceled as he is dealing with an illness at this time of some sort, whether it be a cold, which is what they're going with, or something else. We don't know. He is in his 80s, so something to keep an eye on. Also, Philadelphia. Yesterday, this is good. This is a good number. I'm actually happy with this. Philadelphia yesterday recorded 797 EMS calls, which is down. It's the first day below 800 in quite some time, so I'm happy about that. Will it last? I don't know. Only time will tell. Something that's a problem in Pennsylvania, whooping cough. In fact, in Pennsylvania, there has been a 900% increase in the number of whooping cough cases. I know, that is just a crazy number. And up in the Lehigh Valley, which is here in eastern Pennsylvania, but north of the Delaware Valley, which would be southeast Pennsylvania. So we'll talk about Allentown area, Bethlehem area. Near there, the East Penn School District is dealing with whooping cough. So this is actually southwest of that area, but again, they are dealing with a case of whooping cough, and they're advising parents to be mindful of that, hey, I mean, this could spread, and maybe some other kids could have potentially been exposed to that. All right, we had a new study yesterday that came out about COVID in the brain. There have been several over the years. Some of it is archived over on my site, datareport.info. In other words, I start a thread, I give a little, description or title for the thread, and then it links you to these studies. And COVID in the brain, it is a real problem. The latest study saying people who have been hospitalized with COVID, sometimes the brain ages equivalent to 20 years. Yes, 20 years of regular brain aging happens in a matter of a short period of time with a COVID infection. Remember, we're talking about 20 years of aging. COVID started back in 2020. Here we are in 2024. So what is this, the 5th year of COVID now? And yes, so yeah, COVID's doing something that takes 20 years to happen, and it's happening really quick. And if you're older, maybe you're someone that's late 60s, 70s, well, think about this. 20 years of brain aging. Maybe you had early set Alzheimer's, unfortunately. I mean, there's a lot of people that do. And then you get COVID. Maybe it gets severe, maybe it's not severe. It progresses that faster. And that's something that's not good. That's something we need to be mindful of. There's an easy way to help prevent COVID infections. This right here, masking. If more people would wear a mask and stop complaining about having to wear a mask, saying, oh, mask doesn't do anything. Hello, N95 mask. Watch. I can put this on like this, and it gets a real nice tight fit. Hear me breathing or blowing air? I can't feel anything. There have been several studies that show an N95 mask blocks 98% of potential COVID transmission. There was a study not too long ago out of Japan that confirms that. I mean, we have some of the tools. That's a tool that we do have. That's a tool that needs to be made more easy to get for people who can't afford them, or whatever the case may be. I mean, we need more education on the harms of COVID. I mean, brain aging, that's just one thing. Long COVID can go on to cause over 200 different symptoms. I've said it many times here on this channel, but it's really true, and we need to take this more serious. I mean, the other day we were talking about testing. I saw on the news last night, local news here in Philadelphia, that now we're back to COVID testing. Kits will be available for every household coming soon. So they're not even giving a date now, and I haven't seen any update today. If anyone knows anything new, let me know in the comments section down below. It's really ridiculous. We don't have access to all these tools. It's really ridiculous how expensive our tools are. Because, let's face it, if someone has to take off work because they're positive from COVID, that costs a lot of money. If someone gets hospitalized, say maybe their healthcare insurance is not great, or unfortunately you don't have healthcare insurance, guess what? That's really expensive. And we know with long COVID, new symptoms popping up, you have to go and see a specialist a lot of times. And it's not always cheap to go and see a specialist. I know for me personally, I will fully disclose this. Every time I go to see a specialist, it's right off the bat, $150 out of pocket. And some people have to pay even more than that. Some people much more than that. And treatments, God forbid, if you do not have the proper treatments or proper insurance, treatments can get very expensive. And I will disclose this as well. I get Exolar treatments for my breathing every month. If I didn't have insurance, if I didn't have copay assistance program, it would cost me $7,500 every 30 days. Who can afford that? But yet people go about their business, la-di-da-di-do-di-da, like COVID is no big deal. Let's stop playing the games. COVID is a big deal. Can you afford that? Can you afford $7,500 a month for a breathing treatment? Can you afford all these other treatments that are out there that you may need after a COVID infection? I know several people who have had COVID just one time. And now it seems like it's opening up a whole can of worms. A specialist for this, a specialist for that. A whole family tree of doctors that they've had to go to because of one case of COVID. We need to stop playing these games, and we need to take it seriously. Alrighty, I don't really have that much else to talk about, but I just wanted to get that out there. We are in the backside of the summer COVID surge. We're coming into fall now. Some areas are struggling to drop. Washington State has been a example of that. Some places saw a brief rise last week. Now they're slowing off again, dropping. We'll get some more numbers throughout the week, but overall, being on the backside is not always safe. You can still get COVID. Levels are still elevated. We saw a model yesterday from the PMC forecast model that shows levels will remain high right on through to a lull that we're going to see in November, and then eventually the holiday surge is going to come in. Will it be the XEC variant? Will it be MV.1? Will something else pop up and just spring up out of nowhere? It is possible, and we need to be prepared. November 1st, hospitals will start being mandated to report again, so we'll probably see a big fake inflation. Fake meaning that, these were people that were all the numbers that really were happening, but it's just going to look so much higher because suddenly we'll actually get to see those numbers that are really happening. And I think even at that, the numbers are still going to be way off. There's people that are going up to hospitals, they're calling it mysterious illness, and And I'm seeing stories about this. They're sick, they're going to the hospital, they're not being tested for COVID. It's a real issue, and I don't think that's going to be changing anytime soon. Alrighty, folks, short update today. We will have a data-filled one tomorrow, and probably Friday as well. And then Saturday, maybe another out in the wild update. We'll see how things go. If you enjoyed this update, give it a thumbs up. Want to see more updates like this? Subscribe down below. Of course, hit that notification bell. Share this video with anyone you know. And leave your comments down below. And please remember to take this virus seriously. I mean, serious. Do you want to end up having to pay a whole bunch of money for a bunch of specialists or a bunch of treatments? How many people can afford that right now? Someone with a family of 4, a husband and wife and 2 kids, that's a big burden. It really is a big burden to have to pay for treatments. And say multiple people in the house get long COVID. Say you can't work anymore. Can you afford that? Most people say they can't afford that. Already coming to you from out here in the wild, as you hear, it's crazy out here. I just heard horns honking. Have a good evening. I will see you all again tomorrow. Thanks for watching.